Essential tremor is the most common movement disorder. It's about 3 times more common than Parkinson's disease. As its name implied, it causes a tremor that we believe begins in a circuit that connects the cerebellum, which is part of the brain in the back of your head, to the part that we treat, which is the thalamus right in the middle of the head, to the cortex. And we know that if we disconnect the cerebellum from the motor cortex at the level of the thalamus, we can get rid of the tremor. Those tremor cells reside in the thalamus, and part of it called the VIM, the ventral intermediate nucleus of the thalamus. That target has been known about for many years. It was targeted in the old days using electrodes, and now we can use focused ultrasound to do the same job we used to do, but not open the head. The procedure itself takes about 2.5 hours. The patient comes in the morning, and we have to put a frame on the head, which means putting some local anesthesia about here and here, and in 2 places in the back. Then we take the patient to the MRI scanner, where they lay on their back for about 2 hours. And I work with the patient throughout the entire procedure to look at their tremor on the table, to see if it's going away, and to also look for side effects, which include the possibility of numbness and tingling or difficulty with moving the arms. The procedure is it can be considered long, being in the MRI, because you're in there for a little while. We have some ways to help you by keeping you warm, keeping you comfortable. We can give medications to make it more of a comfortable day. But generally, patients are happy to get out of the MRI and see how their tremor control is, and then they go home that day, and then come back and see me the next day, and then at 3 months for a follow-up MRI. So that's the entire process as we're doing it here.